Hi, I am Asma Lamichane. I am a third year nursing student. In this presentation, I'm going to talk about a contemporary nursing issue, which is nursing workload. The aim of this presentation is to address the issues regarding nursing workload and understand the factors behind this issue. This presentation also outlines several strategies which has been implemented already and how they can be revised further to address the issues. It also outlines the responsibility of a new grad nurse in dealing with the issue and how effective leadership can mitigate the problem. In this presentation, firstly I'm going to talk about the background of the nursing issue. What causes nursing workload? The importance of nursing workload related to patient safety and a healthy workplace. And what is being done about this issue till now. Moving forward, I'm going to talk about effective leadership skills that may be useful in resolving the problem. I would also provide some concepts and strategies to address the problem. Finally, I'm going to talk about the responsibilities as a new grad nurse and conclude the presentation. What causes nursing workload? Nursing workload is the amount of time, physical and cognitive effort required to accomplish direct patient care, indirect patient care, and non-patient care. There are several factors that causes nursing workload. However, some most common and major factors are less staff or reduced staffing levels, reduced patient length of stay in the hospital, increased nurse to patient ratios, complex patient condition, lack of specialty nurses, failure of management system, and lack of leadership. Why is nursing workload related to patient safety and a healthy workplace? Nursing workload directly affects the quality of care patient receives. Due to heavy workload, nurses may not have enough time to perform their task, which is one of the major risk factors in patient safety. Heavy workload is a key job stressor of nurses that negatively affects the performance and critical thinking, which as a result causes distraction and errors. Heavy workload is considered one of the major factors in medication and safety errors in the hospital. A heavy workload experienced by a nurse affects all other nurses and healthcare providers in the area due to lack of communication and time to help each other. As a result, it builds job dissatisfaction, demotivation, and conflict among nurses. What is being done about the nursing workload? In Australia over the last decade, concern has been raised regarding short staff and nursing workload. Different strategies has been introduced. Some significant strategies identified are nurse to patient ratios or nursing hours per patient day. Nurse to patient ratios is the standard recommended by Australian Health Workforce Advisory Committee. However, study shows that this ratio is not followed all the time in every nursing unit. It is found that these ratios are higher at night in ICU and some acute and surgical wards. They also found poor patient outcomes in those units. Skill mix. There is a mix of healthcare workers like registered nurse, enrolled nurse, assistant in nursing in a unit or ward to reduce workload and help each other as a team. However, studies have shown that there is an improper mix of skills like more majority of registered nurse in some ward and less majority of registered wards in other ward. As a result, some units provide better level of care and some are lacking behind. Workload management. Nursing and midwifery workload management standard has been set to manage the human resources. However, it is found that this standard has been compromised due to certain factors like lack of teamwork, lack of leadership, lack of guidance to newly employed graduates or team member. How effective leadership may contribute to resolve the problem. Clinical leadership is a key factor to healthy operating and supportive environment. Good leadership is always considered as an important factor to ensure quality care and healthy workplaces. In fact, everyone can be a leader if they are 100% responsible to their duty of care and be an example by their work. Every nursing unit has team leader, roasting manager, nursing unit manager, educators, and other staff. It is the duty of every leader to ensure healthy workload among staff from their own level. Similarly, a good leader can ensure healthy communication and coordination in the team, which directly reduces work stress, which is the cause of many safety and medication error in the workplace. In addition to this, a good leader is aware about the standard of practice and should not hesitate to report or escalate the problem, which is one of the main cause of unaddressed workload related issues. What should be done to address the problem? Although nurse to patient ratio is mandatory in Australia, it is still found that these ratios are high during circumstances like short staff, weekends, public holidays, etc., which should be strictly addressed by every health facility, and every staff should be encouraged to report or escalate such issue. Even though nurse to patient ratios is supposed to be effective in reducing workload, it is not as effective if the patients are complex and require equivalently more time. So, nurse to patient ratios should not be followed just by the number of occupied beds, but the complexity of the patient should also be considered while allocating the patient. Skill mix is a new strategy which is still in the developing phase. Although many healthcare facilities are mixing registered nurse, AINs, enrolled nurse, but still there is improper distribution of these skills in acute and general wards. In order to address this issue, hospital and every ward or unit should open more vacancies for the skill mix as required by the facility and revise the skill mix as per the situations. Nursing and midwifery workload management standard is the gold standard to address issues like workload and short staffing. However, such standard should be discussed in ward meetings in order to aware every staff, especially the new graduates and new recruits, to create healthy workplace and healthy environment. It is often seen that these new grads and new workers hesitate to report any workload related issues. So, open discussion platform can be created in the ward to solve the issues on the ground level before escalating the problem. Moving forward, I'm going to talk about the responsibilities of a new graduate nurse in relation to the nursing issue. It is a responsibility of new grad nurse to meet the registered nurse standard of practice, follow code of conducts, and all other legal and ethical values related to the duty of care. As a new grad nurse, it is under the scope of practice to follow the mandatory nurse to patient ratios as allocated in the ward or ICU. However, I would always be aware about the severity of patient while allocating the patient to me and other nurses. As a new graduate nurse, it is my responsibility to work under supervision of RN. However, if I am asked to follow any procedure which doesn't meet the standard of practice, I would not hesitate to say no and escalate the problem. I would be aware about the workload management standard and educate others as well about the standard of practice. I would address any workload related issues on my level under my scope of practice and escalate the problem as per the workload management standard. Now we have come to the end of this presentation. This presentation has helped me to develop good leadership through effective communication skill. Effective communication skill is one of the qualities of good leadership. This presentation format helped to develop creative ideas and most importantly, how a leader would present those ideas in an effective way, so the audience would clearly understand the context of presentation. There is use of simple language, clear voice, bullet points, and some images throughout the presentation, which makes the presentation engaging and easy to understand. Thank you.